soon here. Why our next guest has a ball cap that reads, "Need money for dirt bikes," Doreen.
I think that's probably self-explanatory. He's a little 2-year-old who is the star of the show right now. Welcome, Wyatt, along with Mom Carly, Dad Zach, and Dr. Brodie and Dr. Verbsky?
Yeah.
Thank you guys for joining us. Well, we're here to talk about Wyatt, and your support will help kids like Wyatt get the expert care that they need when they need it. That's what we need, your donations. Now, they ensure that Children's Wisconsin can continue to provide life-changing care for all kids and families, including the very boisterous Wyatt. Now, newborn screenings are something that didn't always happen, but thank God that they do now. This is where your story kind of begins, Mom. Carly, why don't you tell us a little bit about your story and your journey here with Wyatt?
Yeah, so Wyatt was born, oddly enough, at our 36-week checkup appointment.
Weren't expecting that.
Surprise.
We were not planning that at all, and so I remember our OB going into the delivery saying, 4 weeks premature, we really got to be careful with this little baby. And he was born, and he was perfectly healthy as far as we were concerned. Didn't need any support with breathing or eating or anything like that. So we ended up going home 3 days later, thought we had an absolutely perfect baby. We had a pediatrician appointment scheduled for first thing Friday morning to make sure he was maintaining his weight, not having any other issues. And we walked into the pediatrician's office, and a couple minutes later she came in with, we joke it's the Minions, but essentially like a yellow hazmat suit, and she said, "Have you checked your voicemails?" And we were like, "No, what's going on?" And she said, "Well, his newborn screen picked up some very concerning results, and we're sending you down to Children's right now."
Okay, now how do you respond to that?
I'm sorry.
Flight or fight moment, and
I think we just kind of shut down. We had no idea. I think my mind instantly went to denial. This has to be a mistake because we were just told he's healthy. He's been eating, he's been breathing. What else could be wrong with him? So, we got down here at Children's around noon on Friday. We met with a member of Dr. Verbsky's nursing team. We spent quite a bit amount of time with her that day in labs, reconfirming all of his blood tests that did in fact indicate that he had a complete absence of T cells, which indicated he essentially had no immune system whatsoever and was considered a real-life bubble boy.
oh my gosh. Yeah.
Dr. Verbsky is here representing Children's Wisconsin. How was that discovery for you initially, and what was done immediately?
The screening program has been going since 2008, and it actually was started here with money from Children's and the Jeffrey Modell Foundation. We're the first state to screen all babies, and now the entire country does. So I kind of joke, it's now easy. The hard part about SCID is finding the 1 of a million kid who's from every other sick kid. And so that's why we did the screen, because you have to find them early. So we saw the screen, it was pretty clear. We did the testing very quickly, and then we could very quickly give them medicines to keep them safe until we can hand them over to our transplanters like Dr. Brodie, and then they have a very much easier time through transplant. So for us, it's actually pretty straightforward now. We have a screen, we know they have it, we test them, and we know what they have within a couple weeks of life. And you just got to keep them healthy. So it really changed how we take care of this disease.
SCID, by the way, is the acronym describing the life-threatening disorder, and obviously he's doing great so far with this. And then you passed off to another doctor, Dr. Brodie, a hematologist, an oncologist here. What happens when you take over then?
So I'm one of the pediatric bone marrow transplant physicians. I specialize in patients who don't have cancer who need a bone marrow transplant for a variety of reasons. And what we have the opportunity to do is we meet with these families, and I can't imagine what it's like to meet me on the other side and hear that your child needs a bone marrow transplant and hear about what that's going to be like and all the complications that could potentially happen. But me and my group of pediatric bone marrow transplant physicians collaborate with physicians across the country to bring clinical trials and use clinical research to try to make our transplants better for patients, offering them the opportunity to have less complications, have hopefully improvements in their recovery times, and really lucky to be able to say that any patient who needs a bone marrow transplant, we can safely offer one. And we do that through clinical research and the support that Children's gives us to have that team that allows us to do that.
So what is the first step then? Do you test the parents? Do you try and find a relative? Is it just a list?
So it's different from other transplants where there is a list. And as I mentioned, every patient who needs a bone marrow transplant, I can safely say almost 99% of the time will have one. And so we look at brothers and sisters, we look at parents, we look at unrelated donors who are on a registry, and based on what we feel is the best option, we plan our transplant approach around that and have those discussions with the families.
So Dad, Wyatt gets a transplant. How are you guys processing how this is going to go down? You want to fix it as the dad, right? I mean, that's your job as parents.
You want to do the best you can to try and keep everybody calm and make the best decisions for the family.
And to your understanding, how's Wyatt's immune system doing today?
It's doing really good.
Yeah.
Our plan and our goal is to move into the survivorship program in July, which will be his 2-year transplant anniversary date. So as far as we're concerned, he's the typical 2-year-old boy who likes to cause trouble.
Yeah.
Gets sick, puts dirt in his mouth, and
Yep.
All the things we were told he couldn't do, he's now doing.
And enjoys books about giraffes, what Dad is helping him read right now. It's great, right?
Mom, Carly, what would you want others to know about Children's, and why is it so important that they donate?
Yeah, I think as first-time parents, we fully took advantage of the fact that we had this in our backyard. We're local. Until you're someone who needs it, I just don't think you really find the value in it. When we were talking for treatment options for Wyatt, the alternative we had was to do gene therapy, which is a newer form of treatment in Cleveland. And so we went home, we kind of deliberated for a while, and ultimately for us, we felt so safe with the team here at Children's. We knew that they had our best interests and that they wanted what was best for Wyatt. We also knew that we needed our family and our bed to sleep in from time to time, because it's really hard to be new parents on top of everything else that was going on for us. So, yeah.
So Wyatt turned 2 in April, and you guys discovered the immunodeficiency early. Does it sometimes occur later in life with children as well?
It can. This is the most severe form of immunodeficiency in childhood, and it's universally fatal if you don't transplant them and find them before they get an infection. And that's why this program is so important, is because these babies look healthy, they look normal, and they have no immune system. So that's why we did the screening program. And I'll just say the Children's Hospital at the very beginning put in about $250,000 to do the first statewide screen, and that was from the donors and the Children's Hospital Foundation. And we had to show you could do it statewide, and we did. And now it's across the world. So, and now we've not lost a baby with SCID who has been screened since then.
That is amazing.
It's the disease is kind of gone if you get screened. It's great.
Yep, and that is all because of the community support and the donations. So please pick up the phone, 414-337-9554. You can text WKLH to 51555 or go online to WKLH.com. We need your donations. So, we don't know what the future may be, what the next screening may be necessary. And with the research and the donations, that's how we find out.
And Dr. Brodie, you said you had moved from the East Coast and had been in a number of different facilities. How do they compare to Children's Wisconsin? Or how does Children's Wisconsin maybe compare to them?
Yeah, I would say the reason I'm here and the reason, I was here and I left a little and I came back, but the reason I came back was because of the sense of family that we have amongst even our physician colleagues, the collaboration we do, the research support, the support from Children's, and that gives us the opportunity to really build relationships with families, take them through this process that's not an easy one to go through, even on the quote-unquote easiest track, and it really allows us to do what we love to do.
Children's is a unique place.
It is, and we need your support to continue on. 414-337-9554. Thank you all for sharing your stories and sharing Wyatt with us this morning. We appreciate it.
Thank you.